Hearing you have glaucoma comes with a heavy reality. Your vision now depends entirely on one strict routine: taking eye drops every single day for the rest of your life. These aren't like over-the-counter vitamins where you can take a few days off and be fine. If you treat these medications casually, you risk your sight. Once glaucoma destroys your vision, no treatment on earth can bring it back. To understand why, look at this diagram of the eye's internal plumbing. A healthy eye is constantly producing fluid, called aqueous humor, while simultaneously draining it out. It operates on a perfectly balanced 24-hour cycle. But glaucoma breaks this biological cycle. Either the eye starts producing too much fluid, or the drainage pathway narrows. With nowhere to exit, that fluid accumulates inside the front chamber, causing the internal pressure to rapidly spike. That trapped pressure is forced backward, physically crushing the optic nerve, the vital cable that sends images to your brain. Mechanically managing that internal fluid pressure is the absolute only way to stop the physical destruction of that nerve and prevent permanent blindness. While a doctor writing a prescription for daily drops seems incredibly simple on paper, actually living with that requirement places a massive logistical burden on a patient's daily life. Take the case of an elderly woman who traveled to a clinic from a rural village in Jharkhand, diagnosed with an advanced stage of the disease. For her, a chemical treatment plan was practically impossible. She lived far from any pharmacy, meaning a refill could take 2 weeks to arrive. She lived alone with no one to help administer the drops, and struggled to remember the strict timing required to keep her pressure down. Because lifelong drops were an instant setup for failure in her environment, her doctor skipped the pharmacy entirely. Instead, they opted directly for surgical intervention to physically alter the eye's drainage system and lower the pressure. Surgery handles these extreme logistical cases, but for the millions of other patients who rely on daily medication, they have to navigate a complex, lifelong chemical minefield. Today's medical arsenal features 6 primary categories of glaucoma drugs. Each is engineered to solve the plumbing problem by doing one of 2 things: slowing down fluid production or forcing the drain open wider. First is pilocarpine, the oldest drug class. It successfully stretches open the eye's drainage meshwork, but it forces the pupil to shrink tight, frequently causing severe headaches and making it incredibly dangerous to drive at night. Next are prostaglandin analogs, or PGAs. These are the most potent and commonly prescribed drops because they only require a single daily dose to significantly increase fluid outflow. Then we have alpha-2 agonists, like bromonidine. As this flowchart shows, it is a unique dual-action drug. It simultaneously shuts down fluid production on one end while widening the exit pathways on the other. Fourth are beta blockers. They are highly effective at reducing fluid, but they can cross into the bloodstream, dangerously lowering a patient's heart rate or triggering severe asthma attacks. Fifth are enzyme inhibitors. They also reduce fluid levels, but they come with intense stinging sensations upon application and carry severe risks of allergic reactions for anyone with an underlying sulfa allergy. Finally, there are Rho kinase or ROCK inhibitors. This is the newest class of drugs on the market, specifically targeting and relaxing the eye's drainage meshwork to let fluid escape more efficiently. These 6 chemical tools are remarkably effective at saving a person's vision, but as a trade-off, patients are forced to endure a daily battery of severe local and systemic side effects. The physical toll of these medications is heavy. Patients deal with extreme eye redness, blistered skin around the eyelids, unnatural eyelash growth, and even cognitive issues like severe sleepiness or confusion. Consider a police officer from Uttar Pradesh whose eye pressure was perfectly managed by those highly potent PGAs. Medically, his chart looked flawless, but physically, the PGAs made his eyes so radically bloodshot that the public began assuming he was intoxicated. This put his doctor in a tough position. They chose to completely abandon the most medically potent drop available, switching him to a completely different medication just to protect his career and reputation. Glaucoma treatment must align with a patient's professional and personal lifestyle as much as it does their ocular chemistry. Because these side effects are so disruptive, patients have to take physical control over how these medications enter their bodies. To prevent local skin issues like dark pigmentation or blistering, doctors recommend using a physical barrier. Holding a clean tissue paper tightly under the eye during application keeps the chemicals from ever touching the sensitive surrounding skin. Systemic side effects occur because of how these drops travel. They move from the tear ducts, called punctums, directly down the nasal pathway into the throat, eventually entering the bloodstream to cause sleepiness or altered heart rates. To stop this, patients use a technique called punctal occlusion. By gently pressing fingers against the tear ducts for 5 minutes after putting in drops, the medication is trapped strictly in the eye area, unable to drain down into the body. The effectiveness of a treatment depends on finding a medication tailored to a person's specific biology, internal pressure levels, and daily constraints. Surviving glaucoma requires a rigid daily routine and clear communication with your doctor to balance medical efficacy with your lifestyle. By using practical techniques to control the chemistry, you can protect your vision without sacrificing your quality of life.